Hi, good morning. Thank you, Dr. Fekete, for taking the time to be with us. My name is Arturo Aceves. I am the Director for Business Development for Philadelphia International Medicine. Doctor, would you mind to introduce yourself and tell us what is that you do at Temple?
Sure. My name is Dr. Thomas Fekete. I'm an infectious diseases doctor. I'm also chair of medicine at Temple Hospital and Temple University School of Medicine.
Thank you, Doctor. Doctor, we are aware of the coronavirus that is very prevalent now on the news. Will you mind to tell us what is a coronavirus?
Coronavirus is a virus that tends to cause a cold. We've known about coronaviruses for many years. This particular coronavirus we've known about for less than 2 months. We believe it originated in China, that we think it probably came from animals and hopped into people, as sometimes these things can do. And we know now that it's been found in other parts of the world as well from travelers who've come out of China.
Doctor, so what is the difference between this coronavirus and other coronaviruses that we have had in the past?
The most common coronaviruses we've had in the past have been viruses that cause a common cold, nothing particularly serious, the kind of cold you stay home from work for a couple of days and then you're fine. Nothing as severe as a bad influenza, so a kind of virus you wouldn't pay much attention to beyond the symptoms that it produces. This coronavirus, we think, is likely to be more severe. We know that in some people it causes severe respiratory illnesses and it's even led to death. So that's typically something you see with more severe viruses like influenza. This one is definitely a little bit more worrisome.
Okay. Doctor, on this instance, what should we do with this coronavirus?
The first step is to understand where it is and how to diagnose it. And right now, the tools we have are not commercially available tools. They're tools that are put together by government agencies and laboratories. So we're a little bit behind in understanding this at the level of individual patients being seen in clinics around the country.
Okay. Doctor, we've heard in the news that there might be some difference in how the virus attacks men and women. What is your take on this one?
I think it's a bit early to know that right now. What we do know is the virus is more severe in people who have underlying medical problems. People with diabetes and chronic medical conditions seem to get sicker and seem to have a higher mortality, and that may be partly just what we're seeing with the male-female balance in the current form. We'll have to watch this very closely.
Doctor, in the past we have other viruses in the Asia region. It comes to mind SARS. What's the difference between SARS and this coronavirus?
So SARS was a very serious virus infection, also a respiratory virus, kind of like this one. But we know with SARS, people got ill very, very quickly, and there's a high mortality rate in SARS, which was first picked up in Hong Kong, but then sort of traveled around the world, and everywhere it went, it seemed to have a fairly high mortality. We know the SARS virus did jump from person to person, so we know that as a risk for healthcare providers. In fact, many of whom got sick with the SARS virus, both in Hong Kong and China, as well as other parts of the world. This virus does not seem to be as adept at jumping from person to person, probably not as scary as SARS, and we believe the mortality rate is much, much lower than SARS.
Okay, so what should we do, the steps we take as prevention for this coronavirus?
People remember during the SARS epidemic that folks were walking around wearing masks a lot of the time, these respirator masks, and no one knew if that was really effective or not, but perhaps it was a bit effective in reducing the infectivity of the virus. And we know that in the hospital, when people come in with viral infections, they are put in a private room, and people who visit are asked to wear masks so they don't end up picking up the virus. That's the kind of prevention perspective. If you think you do have a virus like this, if you think you might be ill, just stay at home and not expose people to the virus. It's probably best to stay away from public gatherings like sports events, theater, and other kind of places where people congregate, because there is a concern that one person might infect a number of people in these venues. If you have a kid with this, you probably want to have them stay out of school so as not to infect the kids at school, and probably best to have sick relatives not come and visit in case they should become infected.
Okay, thank you, Doctor. Is there any other recommendations that you can give us that we can follow? Any other information that should be of value to the people?
We have to sort of see what we can come up with in terms of treatment, but I'm not optimistic because we have no treatment for any coronavirus. So the goal is to obviously prevent people from getting ill. If they have concomitant medical problems, to treat those so we don't end up with complications like heart failure and so on and so forth becoming worsened by the virus infection. This happens with influenza, other viruses, so important to get good medical care. And like I said, to avoid contamination of other people by staying away from public venues, and if you have to be in the hospital, put people into the kind of rooms where they're not going to convey this to other hospitalized patients.
Dr. Fekete, thank you very much for your time.
My pleasure.
And we're looking forward to hear more from you and more recommendations.
Thank you.
Thank you.